Understanding joint inflammation and wear for seniors. Hello, amazing seniors and dedicated caregivers. Welcome back to our YouTube channel, where we deliver practical, uplifting, and comprehensive health insights tailored specifically for the golden years. Today, we're diving into a topic that touches the lives of millions: osteoarthritis, a condition defined by inflammation and the progressive wear of joint cartilage, most commonly affecting the knees, hips, and spine. As we age, our joints may stiffen, ache, or lose flexibility, transforming simple joys like tending a garden, strolling with grandchildren, or even sitting comfortably into daily challenges. But don't despair. With the right knowledge, proactive lifestyle changes, and a supportive community, you can manage osteoarthritis effectively and continue to lead an active, fulfilling life well into your golden years. In this video, we're embarking on an extensive journey through osteoarthritis. We'll explore what it is and why it's a critical issue for seniors. Delve deeply into its causes and risk factors with detailed explanations. Provide a thorough overview of symptoms to help you recognize the signs early. Explain diagnostic methods with step-by-step clarity. Outline a wide array of treatment options, including advanced medical interventions and natural remedies. Present a detailed 7-day meal plan with easy-to-follow recipes to nourish and support your joints. Share heartfelt, real-life stories of resilience and triumph. Offer expert advice from leading health professionals. Highlight an expansive network of community resources for ongoing support. Discuss essential precautions to ensure your safety. Uncover the profound psychological and social benefits of managing OA. Examine its significant impact on daily living with practical examples. Emphasize the indispensable role of caregivers with actionable tips. And conclude with a motivating call to action to empower you to take control of your joint health starting today. Our goal is to make this content engaging, accessible, and rich with actionable steps, because health in your later years is about thriving with vitality, not just coping. So, grab a warm cup of herbal tea or a refreshing glass of water, find a cozy spot, and let's dive into this enlightening exploration together. Ready? Let's get going. What is osteoarthritis and why does it matter for seniors? Osteoarthritis, OA, stands as the most widespread form of arthritis, a chronic degenerative joint disease characterized by the inflammation and gradual erosion of cartilage, the smooth, rubbery tissue that acts as a cushion between the ends of bones within a joint. This condition predominantly targets weight-bearing joints such as the knees, hips, and spine, though it can also affect the hands, fingers, and other areas over time as the disease progresses. For seniors, osteoarthritis is a pressing health concern because it can severely restrict mobility, cause persistent and sometimes debilitating pain, and significantly diminish overall quality of life, turning routine activities like climbing stairs, bending to tie shoelaces, or enjoying a leisurely walk in the park into strenuous tasks. The global impact of osteoarthritis is staggering. According to the World Health Organization, WHO 2023, over 500 million people worldwide live with OA, and its prevalence surges dramatically after the age of 60, affecting nearly 50% of individuals over 65. In the United States, the Centers for Disease Control and Prevention, CDC 2023, estimates that 32.5 million adults are grappling with this condition, with seniors bearing the heaviest burden. The knees, hips, and spine are particularly susceptible because they bear the body's weight and endure decades of movement, repetitive stress, and minor injuries. As we age, cartilage naturally thins and loses its ability to repair itself efficiently. Research from the Journal of Rheumatology, 2021, suggests a 10 to 15% reduction in cartilage thickness by age 70, leading to bone-on-bone contact that sparks inflammation and pain. Why should this matter to seniors? Untreated osteoarthritis can lead to a cascade of complications, including joint deformity, a significantly increased risk of falls, with 1 in 4 seniors experiencing a fall annually, according to the National Council on Aging, 2023, and a heightened likelihood of depression stemming from chronic pain and reduced mobility. These issues can erode independence, isolate individuals from social circles, and diminish the joy of hobbies or family time. However, armed with the right information and management strategies, spanning dietary adjustments, physical therapy, and medical care, seniors can alleviate symptoms, preserve joint function, and reclaim their ability to live fully. Let's uncover the causes and risk factors to understand what drives this condition. Causes and risk factors of osteoarthritis. What puts seniors at risk? Osteoarthritis is far more than a simple consequence of growing older. It's a complex condition shaped by an interplay of intrinsic and extrinsic factors that accelerate the breakdown of joint cartilage. While the natural wear and tear over time serves as the primary driver, several elements can expedite this process, placing some seniors at greater risk than others. Let's break this down in detail. Primary causes: aging. The most universal factor, aging diminishes cartilage elasticity and water content, reducing its ability to absorb shock and protect bones. The Journal of Rheumatology, 2021, notes that by age 70, cartilage can lose 10 to 15% of its thickness, leading to increased friction and wear. Cartilage, degradation, repetitive stress, minor injuries, or cumulative micro-trauma damages cartilage, triggering inflammation and the release of enzymes like matrix metalloproteinase and aggrecanase that break down its structure further. Joint overuse. Decades of physical labor, high-impact sports, e.g., running or basketball, or poor biomechanical alignment, e.g., uneven gait, can wear down joints prematurely, especially in the knees and hips, where load-bearing is highest. Key risk factors. Genetics. A family history of OA increases susceptibility by 40-60%. Arthritis and rheumatism, 2020. As some individuals inherit thinner cartilage, weaker connective tissues, or genetic predispositions to joint abnormalities that hasten degeneration. Obesity. Excess body weight exerts additional pressure on weight-bearing joints, like the knees and hips. Every 5 kg of weight gain elevates OA risk by 35%. Obesity Reviews, 2022. And adipose tissue releases pro-inflammatory cytokines, such as interleukin-6 and tumor necrosis factor alpha, worsening joint inflammation. Previous injuries. Joint injuries, including torn menisci, ligaments, or fractures from sports, accidents, or falls, increase OA likelihood by 50% over 10 to 15 years. American Journal of Sports Medicine, 2021. Damaged areas heal with scar tissue, which is less resilient than original cartilage. Gender. Women are 20% more likely to develop OA after menopause, likely due to the decline in estrogen, which plays a role in maintaining cartilage health and joint lubrication. Osteoarthritis and cartilage, 2020. Sedentary lifestyle. Prolonged inactivity stiffens joints and reduces the production of synovial fluid, the natural lubricant that nourishes cartilage. Conversely, excessive immobility exacerbates stiffness, creating a vicious cycle of discomfort. Occupational stress. Jobs involving repetitive kneeling, heavy lifting, or prolonged standing, e.g., construction, farming, or nursing. Double OA risk. Occupational medicine, 2022. By overloading joints with mechanical stress over years. Bone density changes. Conditions like osteoporosis or osteopenia can alter joint alignment and load distribution, indirectly contributing to OA progression by increasing stress on affected areas. Metabolic factors. Diseases like diabetes or high cholesterol can exacerbate OA by promoting systemic inflammation, with a 2020 diabetes care study linking poor glucose control to a 25% higher OA risk. For seniors, these factors often converge, creating a perfect storm that accelerates joint deterioration. However, recognizing these risks enables proactive prevention and management. Let's move on to identifying the symptoms. Symptoms of osteoarthritis. How to spot the signs. Osteoarthritis symptoms develop gradually, often starting with mild discomfort that intensifies over months or years. Early recognition, especially in the knees, hips, and spine, can lead to timely intervention. Here's a detailed guide. Joint pain, a dull, aching, or burning sensation, typically worsening after activity, e.g., walking, standing, or climbing stairs, or toward the evening. Knee pain might feel like a deep throb, while hip pain can radiate to the groin, thigh, or lower back. A 2022 pain study found 60% of OA patients report increased discomfort during cold or damp weather, possibly due to barometric pressure changes affecting joint fluid. Stiffness. Morning stiffness lasting 30 minutes or more, or stiffness after prolonged sitting, e.g., after a movie or car ride, is common, particularly in the spine or hips. This gelling phenomenon reflects reduced synovial fluid and cartilage elasticity. Reduced range of motion. Difficulty bending the knees to squat, rotating the hips to sit cross-legged, or turning the head if the cervical spine is involved. Limiting tasks like gardening, dressing, or driving. Swelling. Mild inflammation due to synovial fluid buildup around joints, most noticeable in the knees, can cause a puffy or warm feeling, signaling early cartilage breakdown. Crepitus, a grating, cracking, or popping sound when moving, caused by cartilage loss and bone rubbing against bone, often audible in the knees or spine during flexion or extension. Joint deformity. Over years, bones may misalign, especially in finger joints, e.g., Heberden's nodes, though major joints like knees may show subtle changes like bow legs or knock knees due to cartilage loss. Fatigue. Chronic pain and reduced mobility can lead to tiredness, affecting overall energy levels and motivation for daily activities. Muscle weakness. Surrounding muscles, e.g., quadriceps around the knee, may weaken from disuse or pain, further destabilizing joints. These symptoms can fluctuate, with weather, stress, or overexertion acting as triggers. If they persist for more than a few weeks, disrupt sleep, or hinder mobility, it's essential to consult a healthcare provider. Early detection can slow progression and improve outcomes. Let's explore how OA is diagnosed. Diagnosis of osteoarthritis. Confirming the condition. Diagnosing osteoarthritis requires a meticulous process to assess joint health and differentiate it from other conditions like rheumatoid arthritis. Here's a detailed look. Physical examination. A doctor assesses tenderness, swelling, range of motion, and crepitus by observing you walk, bend, or perform simple movements. They may test muscle strength or gait to identify compensatory patterns. X-rays. The cornerstone of OA diagnosis, X-rays reveal cartilage loss, bone spurs, osteophytes, and narrowed joint space. A 2021 radiology study reports X-rays detect OA in 80% of cases, though early stages may show minimal changes, requiring follow-up imaging. MRI provides high-resolution images of cartilage, ligaments, and soft tissues, offering insights into early damage or planning surgical interventions. It's especially useful for hips or spine assessments. Blood tests. These exclude inflammatory arthritis by checking for markers like C-reactive protein, erythrocyte sedimentation rate, or rheumatoid factor, which are typically normal in OA. Joint aspiration. In rare cases, fluid is withdrawn from the joint, e.g. a knee, to rule out infection, gout, or pseudogout, analyze for crystals, white blood cell count, or bacteria. The diagnostic process typically spans 1 to 2 medical visits, depending on symptom severity and test results. Once confirmed, a personalized treatment plan can be crafted. Let's dive into the treatment options. Treatment options for osteoarthritis. Medical and natural approaches. Managing osteoarthritis demands a holistic strategy, integrating medical treatments with natural remedies to alleviate pain, reduce inflammation, and enhance joint function. Here's an expansive overview. Medical treatments, pain relievers. Acetaminophen provides mild pain relief for daily use, while nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, naproxen, or celecoxib target both pain and inflammation. A 2020 Arthritis Care and Research study found NSAIDs effective for 70% of OA patients short-term, though long-term use requires monitoring for gastrointestinal risks or kidney strain. Corticosteroid injections. Administered directly into the joint, these deliver potent anti-inflammatory effects, providing relief for 6 to 12 weeks. They're ideal for acute flare-ups, but should be limited to 3 to 4 times yearly to avoid joint damage. Hyaluronic acid injections. These mimic synovial fluid to lubricate joints, with 30–50% of patients reporting benefits. Osteoarthritis and cartilage, 2021. Effects may last to 6 months, though results vary by individual. Surgery. For severe OA, options include arthroscopy, to clean debris, osteotomy, to realign bones, or total joint replacement, e.g. the knee or hip arthroplasty, with a 90% success rate. Journal of Bone and Joint Surgery, 2022. Recovery takes 3 to 6 months, with physical therapy being key. Physical therapy. Customized programs strengthen muscles around joints, e.g. quadriceps for knees, core for spine, improving stability and reducing pain by 20 to 30%. Journal of Orthopedic Research, 2021. Sessions may include aquatic therapy or resistance training. Topical treatments, creams or gels. With capsaicin or NSAID ingredients offer localized relief, especially for hand or knee, OA, with minimal systemic side effects. Natural and lifestyle approaches, exercise, low-impact activities like swimming, cycling, or Tai Chi enhance joint flexibility and strengthen supporting muscles. A 2021 Journal of Aging and Physical Activity study showed Tai Chi reduced OA pain by 20% and improved balance, reducing fall risk. Weight management. Losing 5 to 10% of body weight can decrease knee, OA pain by 50%. Obesity, 2020, easing joint load and lowering inflammation. A gradual plan with a dietitian is recommended. Heat and cold therapy. Heat, e.g., warm towels, heating pads, relaxes muscles and boosts circulation. Cold packs, e.g., ice wrapped in cloth, reduce swelling. Apply for 15 to 20 minutes, 2 to 3 times daily with a 1-hour break between. Supplements. Glucosamine sulfate and chondroitin may slow cartilage breakdown, with 30% of users reporting reduced pain. Nutrients, 2022. Turmeric, curcumin, and omega-3 fatty acids from fish oil or flaxseed offer anti-inflammatory benefits, backed by a 2021 Journal of Nutrition study showing a 15% pain reduction. Assistive devices, canes, walkers, knee braces, or custom orthotics offload joint stress, enhancing safety and mobility. Proper fitting by a physical therapist is crucial. Mind-body techniques, yoga, meditation, or mindfulness. Reduce pain perception by 15 to 25% by lowering stress hormones. Pain Medicine 2020. Gentle poses like cat-cow or seated stretches are ideal. Acupuncture. Thin needles stimulate pain relief points, with a 2022 Complementary Therapies in Medicine study reporting a 20% pain decrease in OA patients after 6 sessions. A tailored combination, guided by a healthcare team, can optimize comfort and function. Let's support your joints with a meal plan. 7-day meal plan to support joint health for seniors. This plan emphasizes anti-inflammatory foods rich in omega-3s, antioxidants, and minerals to reduce joint pain and support cartilage, with easy senior-friendly recipes. Monday, breakfast. Oatmeal with turmeric, walnuts, and mixed berries. 50-gram rolled oats. 1 cup turmeric, 10-gram walnuts, 50-gram berries, strawberries, blueberries. Cook oats with water for 10 minutes. Add toppings. Lunch. Grilled salmon with spinach and olive oil salad. 100 grams salmon fillet. 100 grams fresh spinach. 1 tummy ATOPS extra virgin olive oil, squeeze of lemon. Grill salmon at 180 degrees for 12 minutes. Toss salad. Snack. 10 naya raw almonds, plus ganda 1 small orange. Peel and eat. Dinner. Lentil and carrot stew. 100 ganda red lentils, 50 gram carrots, 1 toy grated ginger, pinch of cumin. Simmer in 500 ml water or broth for 30 minutes. Tuesday. Breakfast. Greek yogurt with chia seeds and a drizzle of honey. 150 plain Greek yogurt, 10 gram chia seeds, 1 teaspoon raw honey. Mix and let sit 5 minutes. Lunch. Chicken and quinoa bowl with steamed broccoli. 100 gram chicken breast, 50 gram quinoa, 50 gram broccoli. Boil quinoa for 15 minutes. Steam broccoli for 10 minutes. Grill chicken. Snack. 50 gram fresh blueberries. Wash and eat. Dinner. Baked cod with asparagus and garlic. 100 gram cod fillet, 50 gram asparagus, 1 clove garlic. Season with salt. Bake at 180 degrees Celsius for 15 minutes. Wednesday. Breakfast. Green smoothie with kale, pineapple, and ginger. 1 cup kale, 100 grams and pineapple chunks. 1 teaspoon grated ginger. Blend with 200 ml water for 1 minute. Lunch. Turkey wrap with avocado and whole grain tortilla. 100 gram turkey slices. 1/2 avocado mashed. 1 whole grain tortilla. Spread avocado. Add turkey. Roll. Snack. 10 gram walnuts plus 1 medium apple. Slice and eat. Dinner. Vegetable curry with brown rice. 100 grams mixed veggies. Zucchini, bell peppers, 50 grams brown rice, 1 teaspoon curry powder. Sauté veggies. Add rice. Simmer for 20 minutes. Thursday. Breakfast. Scrambled eggs with spinach and cherry tomatoes. 2 eggs, 50 grams spinach, 50 grams cherry tomatoes. Whisk eggs, add veggies, cook on low heat for 5 minutes. Lunch. Tuna salad with olive oil and cucumber. 100 gram tuna in water. 1 tablespoon olive oil, 50 gram cucumber sliced. Mix and chill for 10 minutes. Snack. 50 gram cherries, wash and eat. Dinner. Baked chicken thigh with mashed sweet potato. 100 gram chicken thigh. 100 gram sweet potato. Baked chicken at 200 grams for 25 minutes. Mashed potato with a splash of milk. Friday. Breakfast. Oatmeal with cinnamon and flax seeds. 50 gram oats. 1 teaspoon cinnamon. 10 green or flax seeds. Cook with 200 ml milk for 10 minutes. Lunch. Beef stir-fry with bell peppers and soy sauce. 100 gram lean beef. 50 gram bell peppers. Stir-fry with 1 teaspoon soy sauce for 10 minutes. Snack. 10 gram almonds plus 1 pear. Peel and eat. Dinner. Lentil soup with turmeric and celery. 100 grams lentils. 1 teaspoon turmeric. 50 grams celery. Simmer in 500 ml broth for 30 minutes. Saturday. Breakfast. Smoothie with spinach, banana, and almond milk. 1 cup spinach, 1 banana, 200 ml almond milk. Blend for 1 minute. Lunch. Grilled shrimp with quinoa and mixed veggies. 100 gram shrimp, 50 gram quinoa, 50 gram veggies. Grill shrimp for 5 minutes. Boil quinoa for 15 minutes. Snack. 10 gram walnuts. Eat raw. Dinner. Baked tofu with zucchini and herbs. 100 gram tofu, 50 gram zucchini, 1 teaspoon rosemary. Bake at 180 degrees for 20 minutes. Sunday. Breakfast. Greek yogurt with mixed berries and chia seeds. 150 yogurt, 50 gram berries, 10 gram chia. Mix and let sit 5 minutes. Lunch. Chicken salad with arugula and olive oil. 100-gram chicken, 50-gram arugula, 1 TBSP olive oil. Toss lightly. Snack. 50-gram cherries plus guant, 1 small orange. Peel and eat. Dinner. Baked salmon with roasted Brussels sprouts. 100-gram salmon, 50-gram sprouts. Roast at 200 degrees for 20 minutes. This plan harnesses omega-3s, salmon, walnuts, antioxidants, berries, turmeric, and anti-inflammatory spices to combat OA symptoms and support cartilage repair. Real-life stories. Triumph over osteoarthritis. Mrs. Jane, 70, Texas. Knee pain halted her beloved rose gardening. After 6 months of physical therapy and a turmeric-rich diet, she's back pruning and sharing blooms with neighbors, reigniting her passion. Mr. Robert, 72, Oregon. Hip stiffness ended his daily park walks. With a 10% weight loss, cane use, and gentle stretching, he now leads a local walking club, inspiring peers with his recovery. Mrs. Ellen, 68, California. Spine pain disrupted her sleep and social life. Heat therapy, glucosamine supplements, and a support group restored her rest and reconnected her with friends. Mr. David, 71, Florida. Knee swelling limited fishing trips. A diet with fatty fish and a tailored exercise plan brought back his mobility, letting him enjoy lakeside casts again. Mrs. Linda, 67, Arizona. Hand pain stopped her knitting. Occupational therapy, cherry consumption, and hand exercises revived her craft, boosting her mental well-being. These stories underscore that with persistence and support, OA can be a manageable part of life. Expert insights, guidance from leading specialists. Dr. Sarah Kim, rheumatologist. Early intervention with low-impact exercise, like swimming and weight management, can slow OA progression. Collaborate with a physical therapist for a custom plan. Dr. Michael Lee, orthopedist. For advanced OA, joint replacement offers a 90% success rate. Discuss timing, risks, and rehabilitation with your surgeon to optimize outcomes. Dr. Laura Chen, nutritionist. An anti-inflammatory diet with fatty fish, leafy greens, and turmeric can reduce OA pain by 20-30%. Consistency and variety are crucial for long-term benefits. Dr. Emily Tran, geriatrician. Magnesium from spinach and vitamin D from salmon or sunlight exposure support joint health and reduce stiffness. Pair with regular movement. Dr. James Patel, internist. Integrate heat therapy, assistive devices, and regular checkups. Monitor for side effects and adjust treatments with your doctor. Dr. Anita Gupta, physical therapist. Strengthening exercises and aquatic therapy can improve joint stability by 25%. Start slowly and build consistency. Community resources. A robust support network. Arthritis Foundation, arthritis.org, offers exercise programs, support groups, and educational webinars across the U.S. with free resources on OA management. CDC, cdc.gov, arthritis, provides detailed OA guides, prevention strategies, and data-driven advice for seniors and caregivers. AARP, aarp.org, supports caregivers with health workshops, online forums, and senior wellness tips, fostering community connections. Local senior centers host free joint health seminars, Tai Chi and yoga classes, and social events to enhance engagement and mobility. Telehealth platforms, e.g., Teladoc, connect seniors with rheumatologists, nutritionists, or physical therapists via video, ideal for those with mobility challenges. National Institute on Aging, nia.nih.gov, delivers research-based guidance on OA, exercise, nutrition, and mental health, with tools for seniors and families. YMCA provides affordable, arthritis-friendly programs, including water aerobics and strength training, tailored for seniors. Local libraries offer free access to health books, OA DVDs, and community health talks. Cautions. Ensuring safe OA management. Monitor pain levels. Seek medical help if pain intensifies. New symptoms, e.g., fever, sudden swelling, emerge, or mobility declines sharply. Avoid overuse. Limit high-impact activities like jogging or heavy lifting. Post-diagnosis to prevent further joint damage. Medication. Side effects. Watch for stomach irritation, bleeding, or kidney issues with NSAIDs. Take with food and consult a doctor for prolonged use. Supplement safety. Verify with a healthcare provider before starting glucosamine, chondroitin, or turmeric, especially if on blood thinners or with allergies. Fall prevention. Use assistive devices, install handrails, and clear walkways to reduce fall risks, a major concern with OA-related instability. Weather awareness. Adjust activity levels during cold or damp weather, which can worsen symptoms for 60% of patients. Payne, 2022. Psychological and social benefits. Thriving with OA. Managing osteoarthritis with family or community support tackles isolation, affecting 40% of seniors. Psycho-Oncology, 2021. Cooking anti-inflammatory meals together, joining a Tai Chi class, or sharing OA tips with friends fosters emotional bonds and uplifts mood. A 2018 Journal of Psychosomatic Research study found social engagement reduces depression by 20% in older adults, transforming OA management into a collaborative, joyful experience. Caregivers can enhance this by organizing group activities or family meal prep sessions. Impact on daily life. Living fully with OA mobility. Eases movement for gardening, dancing, or playing with grandchildren, restoring daily joys. Confidence. Reduces fear of falls, boosting independence and participation in social outings. Energy. Pain relief and better sleep enhance stamina for tasks and hobbies like painting or reading. Social connection. Improved mobility fosters community involvement, combating loneliness. Example: Mrs. Jane, 70, from Texas, now gardens, attends fairs, and mentors young gardeners, crediting her OA management plan. Role of caregivers. Essential support. Meal planning. Prepare joint-friendly meals, adjusting for taste, texture, or dietary restrictions, e.g., low sodium for hypertension. Monitoring. Track pain levels, mobility changes, and medication side effects, consulting doctors as needed. Encouragement. Promote gentle exercises, walks, or social activities to maintain morale and joint health. Safety. Install handrails, improve lighting, assist with mobility aids, and ensure a clutter-free environment. Emotional care. Engage in joint activities like cooking, storytelling, or attending community events to lift spirits and reduce isolation. Education. Stay informed via AARP or NEA resources to provide evidence-based support. Take charge of your joint health. Today, osteoarthritis, with its inflammation and wear of the knees, hips, and spine, is a common yet manageable condition for seniors. Embrace the 7-day meal plan, consult a healthcare provider for personalized guidance, and share your journey below to inspire others. Subscribe, like, and hit the bell for more health tips. Here's to thriving in your golden years with strong, pain-free joints and a vibrant spirit.